Hello, everybody. I am Dr. Anjali Hooda. I am internal medicine MD, as Dr. Karishma also mentioned. And I am speaking on bioidentical hormones. And the reason why I took this topic is because I've been using BHRT actually for more than 2 decades. And I was trained by Dr. Neil Rouzier in the US. And since then, I've been practicing and with a lot of support, of course, by Dr. Kadambi as well. And today I'm going to speak about that. If you can start sharing the slides. So today I'll be covering a few things. I would be covering few hormones that we are using in BHRT. There'll be a list of hormones that I have put in the next slide. I'll be talking about indications, protocols, testing, and the dosage, and how you need to follow up these patients, monitoring, and what are the risks you can actually see, and what are the warnings when cautions where you don't want to use the hormones as a therapy. So, as you all know, as we age, the hormone levels will drop in our body, and we start facing a lot of issues depending upon whether you're a male or a female. There are different issues for both the sexes, and hormones can make a huge difference to someone's life if done properly. Next slide. So why bioidentical hormones? Now, there's a lot of confusion about the bioidentical hormone, which means that they are identical to the hormone in your body, and they may not be always plant derived, but they are mostly plant derived. And do we use it for anti-aging? Is it safe to use? Is it for looking young, feeling young? Or is it therapeutic, or is it risky? So I'll be covering all this. So I'm be talking about growth hormone, DHEA, estrogen, progesterone, pregnenolone, testosterone, thyroid, and melatonin in my topic. And I will only talk about growth hormone at the end because this is something that is slightly controversial still, whether to use it or not. And there are very few indications medically to use them. So why bioidentical and not synthetic hormones? There are risks with synthetic hormones. There is risk of cervical and breast cancers. There's anxiety. There's depression, high blood pressure, blood clots, migraines, and risk of heart disease and stroke. These are the exact things we want to avoid. And when we use bioidentical hormones, the risks of all the above are much more less than when you use the synthetic hormones. Next, please. So I already talked to you about what is bioidentical hormones and why do we call it bioidentical, because it mimics the hormone produced by your own body. It's easier to regulate the dosing when we are doing bioidentical hormones. And for women, I think it's great because some of the hormones are great in treating the perimenopausal symptoms, and they are also compounded and personalized dosages. And for the hormone usage, there are certain pharmacies that we use. We don't generally use the over-the-counter the preparations that are available, the pharmacological preparations. We are not using them. So I want to make sure that everybody knows that we are using bioidentical hormones. The hormone replacement therapy today is going to be about bioidentical hormone replacement therapy. Next slide. So what are the benefits of BHRT? There is great quality of life, age management, you can call it anti-aging, preventive medicine, because a lot of these hormones are helping in prevention of a lot of diseases. Like Dr. Nanda mentioned, there is so many non-communicable disease burden happening to our country, and these are helping in prevention of those age-related also things that are diseases that are happening to us after the age of 40, 50, and they help in prevention of cognitive decline, which is also very important. As we age, we are facing cognition issues. And then sexual dysfunctions. Yes, with age, again, that happens to most of us. And restoring mood and balance, and cardiovascular protection and bone health. So these are the just the few benefits, and I will be talking more about when I talk about individual hormones. Let's talk about estrogen. Now, estrogen is of three types: E1, E2, E3. Generally, the E2 is the main, estradiol is the main hormone, and E1 and E3 are metabolites. E1 is the end metabolite of estrogen. Now, when we give estrogen, what are the benefits we're looking at? Main important benefit for estrogen or estradiol is against the heart disease. And I'll tell you when not to do it. And it improves memory, decreases insulin, and prevents osteoporosis. Very important usage of this hormone after the menopause, and decreases cholesterol and decreases the symptoms of menopause like hot flashes, vaginal dryness, etc. Next one. So, what are the preparations available for this hormone? There's cream and oral tablet, patches, and vaginal creams. Oral pill, I will not recommend for anybody who's been postmenopausal for more than 10 years for the benefit of cardiovascular effects. So you want to go for creams or patches in those people. And when is the real time when to start it? If patient is coming to you, we'll take this is not in the slide, but I'll just like to tell you that when you have a patient and you want to evaluate them for estradiol use, make sure that you know that what is your goal here. The goal here can be whether the person is coming for osteoporosis, whether they're coming for heart disease, whether they're coming for vaginal dryness, whether they're coming for hot flashes, or whether they're coming for decreased collagen in their face, etc. So we have to know what goal we are looking at, and accordingly it's decided what preparation to give to who. And usually in postmenopausal women, at least 1 year should have passed from the last state of menstrual period, and FSH and LH are FSH more 50, LH is over 30, and then we would make sure that, yeah, of course, there's depletion and there's a hormonal panel done, and the estrogen can be started. In women, it's 10 to 30 picogram per ml. So please note that a lot of values are differing from the different labs. So when you're looking at the units, they should be in the units uniformly, because a lot of sometimes there's nanogram, some there's this picogram. So just make sure that when you're looking at the levels while monitoring, those units are similar. And so when we use E3, E3 is estriol, and it is used for skin and per vagina, and it doesn't have any bone or cardiovascular effects. So it's estradiol that has bone and cardiovascular effects. And then when you use the formulations can come as only E2 or as biased and triest, where biased is usually E2 and E3 combination. And I have given an example of a dosage here where 1 to 2 milligram per ml of E2 and 0.1 milligram of per ml of E3 can be used. And your target level is between 60 to 100 picogram per ml. So this is about estrogen, E2 mainly, and sometimes biased and sometimes triest. When we're looking at somebody, so as I said, it's very so personalized. When we're looking for someone, looking at someone who has more skin issues and more vaginal dryness, you can use estriol alone also. It can relieve a lot of symptoms, but my recommendation would be to use estradiol with it. So using biased, that's my favorite formulation to use. But you can take a call after this whole lecture. You can decide what is your goal for this patient. So if the patient is coming for osteoporosis, as you can see, the estrogen works in bone modulation, remodulation. So when someone's coming for osteoporosis, a clear-cut indication of giving estradiol. So if you are confused on whether to give estradiol or not to a postmenopausal woman, just see what you're looking at. If you're looking at somebody who has not just for vanity, see the therapeutic benefits the estrogen can provide to a patient, because monitoring of estrogen becomes very, very, very important. And you also want to know if their MTHFR mutation is not there. So if that is there, you need to be extra careful. Of course, you will be providing with methyl folate as a supplement to that patient. Next slide. Side effects of estrogen. A lot of patients will complain of, so these are the side effects. Some are from articles and some are from my experience. And patient will definitely sometimes say headache, breast tenderness, bloating, acne, this all can happen. So what you need to do is balance it out with the progesterone. And usually the estrogen, if you're giving estrogen to a patient, make sure you're also giving progesterone always. And sometimes they can come up as saying that, okay, the blood sugar went up. Sometimes they will lower the free cholesterol, testosterone levels, because estrogen uses testosterone. So when somebody's on estrogen or somebody's on TRT, a woman on TRT, you must give estrogen also. Then there may be increase of stroke in older women, and especially when somebody has not been on estrogen and they come to you at the age of 70 or 65 and they want estrogen replacement. So you have to be careful. There's also some fluid retention, some patients will say, and some will say that there is high fat, although I would say that estrogen uses only, decreases the visceral fat. So very few patients will complain for the increase in high fat. And if that's happening, you can include some testosterone for that person, for that lady. And caution, be very careful in endometrial cancer or patient with existing thrombosis and fluid retention. And requirements for estrogen use are, if you want to follow up the patients, annual pap smear, annual mammogram, and of course, you're monitoring the levels. I would say 6 months to start for most of the hormones, and then yearly panel. Next one. Progesterone, on the other hand, is like the most vital hormone for a woman, and all women need progesterone. And I would say that no matter what age you are, if you're a adult or pubertal female, your progesterone will regulate a lot of things. And most importantly, women come to me with a complaint of PMS. PMS is one of the most difficult to treat condition, and progesterone is beautifully helping there. Menopause, of course, and perimenopause. And then, as I said, if you're giving estradiol, make sure you always give progesterone. Remember, progesterone is only secreted by the ovaries. So males, there's no indication to use progesterone. So I've not mentioned any male out here. Next one. All right. So what are the dosage and formulations available? There is cream, there is micronized pill, sublingual pill, and sometimes it's a micronized sublingual pill. And then the dose, usually it's 100 milligram QHS is at night. And sometimes you use once a day, sometimes you use twice a day. Sometimes you can start with half the dose of 50 milligram per ml of the cream or tablet, and then we can give it twice a day, morning, evening, to maintain the level, because sometimes people will say with 100 they get bloated. So we can start at 50. Some people will complain of bloating even with the 50. So then see what formulation you are giving. Bloating is more noticed with the oral progesterone and not so much with the cream. So decide your patient according to what is happening with the patient. And optimal ranges to maintain in a person is 10 to 20 nanogram per ml. Remember, this is now nanogram. So when you see these ranges and you see somebody who's come to us, with the very low progesterone stage. So usually low progesterone stage is more common than low estrogen state. So if somebody is having low progesterone, you have to understand that you must replace it, because progesterone is one of the most important hormone for women, and it decreases with age. Next slide. All right, side effects, mostly with oral only, breast tenderness sometimes. And the problem with the cream is that it doesn't bring up the levels as much as the patient is feeling better. So when you're looking at the blood work and you're seeing, okay, it's only 5, the level's only 5, but actually patient's feeling much better. So make sure that you also see how the patient is doing. And but with cream, you can see high salivary progesterone, and it causes somnolence. Some people like it, some people find it not liking the drowsiness, but it can definitely put you to sleep. So progesterone is great for sleep as well. Okay, DHEA. DHEA is now secreted by the adrenal gland. And DHEA, I would say, is for the layman, I would tell you that this is the mother of all hormones. And it increases lipolysis, it enhances the immune system, activates the T cells, positive mood, improves memory and good energy, improves bone density, decreases visceral fat, and improves erectile dysfunction. So you can see that literally it's doing everything what a testosterone or estrogen could do. So sometimes you don't want to use estrogen or TRT, you can just use a DHEA to begin with. That can be the initial treatment. Of course, you have to see levels. Next slide. When you're testing for a DHEA, please test it sorry, there's a typo in here. It's DHEA sulfate. The dosage and formulations are there in terms of cream, tablet, and sustained release micronized capsules. Which is the most common is sustained release micronized capsules. And you want to do up to 50 in the morning for men, or and 10 to 15 sustained release for women in the morning. And some people like to give DHEA at night. I like to give it in the morning because it really makes you very active. So for men, the optimal level could be 500. For women, 200 to 250. Just keep the optimal is always on the higher end of the spectrum. So we don't see the side values for any of these tests. So when you look at the optimal, this is the optimum. So we look at the youth levels for optimal if when we're replacing the hormones. So for everybody who's doing this treatment, you have to see the optimal level of a younger person, whether the person is even 60 or 70. So you have to do the optimal ranges. Next one. Side effect, usually 7-keto DHEA became a little popular some time back, but you have to avoid it. And there is a controversial use of DHEA in lupus patients. And I generally also use it in rheumatoid arthritis, and it's got great, I've found it quite helpful. But these are controversial. There's more studies, more research has to be done, but these can be used also. Low dose can be used for autoimmune conditions. And of course, you have to see the levels as well, right? And the blood levels as well. The side effects can also range from facial hair growth to acne. Some patients will complain this that there is some acne and facial hair growth. Well, you can always decrease the dose. As I said with BHRT, it's more easy to monitor doses than the DHA that you get over the counter in the market or a supplement shop, which is not even great bioavailability. And so you have to see that DHA, when you see in the market, you will see very high doses in the supplement shelf. But when you're giving a bioidentical form, which is very potent, you see that there's only 10, 15, 20, 30, 40, 50 is like maximum for the males. And this is how you have to monitor dose. Next slide. Testosterone. Well, again, testosterone is a great therapy. TRT, many males are on it, and it improves mood, collagen, sense of well-being, muscle strength, stamina, bone formation, reduces hot flashes for women, increases libido, and prevents Alzheimer's, and decreases, like obviously, decreases beta amyloid. So testosterone is secreted by the ovary, adrenal gland, testes. So you see that women need testosterone as well as men. So we have to see who needs the testosterone. So when we go on the you have to, when you see the blood test, you have to always see total and free, because the total testosterone will be combination of testosterone and DHEA, and sometimes it can be bound to protein. So the free level is your guiding dose level for dosing. And you should basically, if you have a low T, which means a
Thank you for the
secondary
introduction.
hypertension.
Really excited and grateful for the opportunity to present my thoughts on the topic psychology, for the opportunity.
I'm sorry, I got distracted. So when for women and men, dosage, what I generally use is 100 milligram per ml on upper thigh for males in creams, and for women I use 1 milligram per ml starting dose for women. And when you see the levels, see the men levels have to be 170 to 200. So when you see on the side of the lab, you will always see like, oh, that's a lot of level, but we have now recently gone up to even higher level, optimal levels for men. And as I said, they are available in cream, patch, pellets, injections. So it depends upon what formulation you're using accordingly. Pellets being the most favorite right now all across the globe, except India right now. So I want to take one more minute on this. Why? Because a lot of people are doing TRT, and they are going and getting these shots done from the synthetic form of testosterone. So please remember that testosterone has to be a bioidentical variety, and since it's oral is toxic to liver, so we don't use that at all. Gel and cream is my favorite. Injection is once a week usually, and that's the synthetic variety. So I stick to more of the cream. And I was doing pellets in the US, but here we don't do pellets, and that's again a great way to secrete testosterone slowly. And testosterone, as you all know, is a great way of keeping your body in the youthful cellular state. So when I say youthful cellular state, which means avoidance of insulin resistance, better muscles, and linearity in the body. Definitely, there is side effect. We can go to next slide. There is side effect of hair loss with the testosterone use. So in that, we have to monitor dose, and of course, it's not for men under 40. So if you're giving it to somebody, make sure that you're not causing infertility if they have completed the family. And it can cause polycythemia, and it can cause aggression. So make sure that you're very, very careful about testosterone delivery system and monitoring. Next one. Pregnenolone not available readily anywhere. Even the levels are not done very frequently, but it's great for memory. I would just say one line about that, that if there is a patient of yours who is having memory issues, pregnenolone can do wonders. Not available in our country as of now, but if you're sourcing the steroids, the hormones from somewhere else, this can be added. Next one. Next, please. Yeah, we can go on. I mean, there's not much side effect to pregnenolone, so I don't want to go there. Thyroid, okay. So thyroid, I'm using a lot of compounded thyroid. Thyroid molecule is a metabolic hormone secreted from the thyroid gland. So when you're doing the panel testing, please make sure you're doing TSH free, T3 free, T4. And sometimes even reverse T3 is used, because a lot of the T3 can get converted into reverse T3 and not available to the person who's taking it. So reverse T3 is an expensive test, sometimes not available in our country. But if you can do it, please do it. And the active form of thyroid is T3. So T4 is what you eat from the pill, the regular, your Thyronorm, levothyroxine and all. But that converts into T3. So three things that really make a huge difference in converting the T4 to T3 is iron, iodine, and selenium. And if you're not having the good amounts of these micronutrients in your diet or your body, there'll be less conversion. So free T3 is something that's a very important marker, and it should be more than 3, and TSH ideally less than 3 as well. And the more the T3, the better the metabolic rate is. And usually form use is desiccated thyroid. It's like coming in grains, half a grain, 1 grain, 2 grain, 3 grain. Safe would be to start half a grain. Next one. And okay, no, previous one only, please. So when we start half a grain, thyroid slide, please. Yeah. So when we start half a grain, you can sometimes, if the patient is cardiosensitive, it can induce palpitations. So make sure that you've taken that cardiac history and then given the patient thyroid. Next one. Melatonin, my favorite. It's secreted from pineal gland while you're asleep and decreases with age. It monitors your stage 4 and it affects your stage 4 and REM sleep. And safe dosage is 3 to 5 milligram. Indication previously only was for circadian rhythms. Now we are giving it for great amount of indications, and it's a wonderful supplement. It's no more used only for jet lag. Now it is used for mood, for Alzheimer's, for immune boosting, for prevention of cancers, and can be used for a long time and very low side effect potential. Next slide. GH, I don't give GH, but I use GH peptides, like GHRP2 and 6, desmorelin, ipamorelin, CGC. I use those. GH is not only indication for GH actually is dwarfism, and so I don't use GH for longevity at all. My usage would be limited to peptides only, because GH has its own side effect potential, as you can see: fluid retention, insulin resistance, aches and pains in the body. So in the end, I would just like to say that don't treat just the patient, treat their symptoms. You can go to next slide. Treat the symptoms. Next one. Treat the patient, not just the symptoms or the number in the lab. Thank you so much.
Thank you so much, Dr. Anjali, for giving the insightful session on the hormones. Most of the questions have been answered by the panel as well. So one question that I would like to ask you is, what is the use of, if people have asked in the chat, what is the use of metformin apart from sleep? So
Melatonin?
Melatonin. I'm
Okay,
sorry.
melatonin. Yeah,
Yeah.
melatonin, as I said, is the antioxidant, to be honest. And it is now, in fact, there was a lot of research done when COVID was there, that it's helping in prevention of COVID. It helps in prevention of breast cancer. It is a great antioxidant for all your processes in the body, and it has such a low side effect potential that it's safe for pretty much everybody to take it. We are giving to autistic children as well, ADHD children as well. So it's a safe medication supplement.
Yeah. Thank you so much for joining us.